Hi everyone, welcome to Pharmacology. So today's video is about prostaglandins. So we know that prostaglandins are hormone-like substances that the body produces in response to injury or illness. They are part of the inflammatory response, which is the body's natural mechanism for healing. And we know that these NSAIDs means non-steroidal anti-inflammatory drugs, act through the inhibition of the synthesis of prostaglandins. These prostaglandins consist of fatty acids and are present in all tissues of the body, including the skin, stomach, and lungs. Okay, more specifically, these prostaglandins are unsaturated fatty acid derivatives containing 20 carbons that include a cyclic ring structure. These compounds are sometimes referred to as icosanoids, okay, whereas this icosa refers to the 20 carbon atoms. Now let's see the role of prostaglandins as local mediators. These prostaglandins and related compounds are produced in minute quantities by virtually all tissues. They generally act locally on the tissues in which they are synthesized and are rapidly metabolized to inactive products at their site of action. This is the reason why prostaglandins do not circulate in the blood in significant concentrations. Thromboxanes and leukotrienes are related compounds that are synthesized from the same precursors as the prostaglandins. So these prostaglandins have hormone-like effects in the body. But unlike hormones, a specific gland does not release them. So this is the difference between the prostaglandins as well as the hormones. These prostaglandins have hormone-like effects, but these prostaglandins are not released by a specific gland. Rather, the body has numerous tissues that can make prostaglandins. Then let's see how the prostaglandins are synthesized. Arachidonic acid is the primary precursor of the prostaglandins and related compounds, and it is present as a component of the phospholipids of the cell membranes. So the precursor of prostaglandins is arachidonic acid, and this arachidonic acid is a component of the phospholipids of cell membranes. This free arachidonic acid is released from tissue phospholipids by the action of phospholipase A2 via a process controlled by hormones and other stimuli. There are two major pathways in the synthesis of eicosanoids from arachidonic acid. So the two major pathways involved in the synthesis of eicosanoids in the sense prostaglandins from the arachidonic acid includes, first one is the cyclooxigenase pathway and the second one is the lipooxygenase pathway. First we will discuss about the cyclooxigenase pathway. Eicosanoids with the ring structures, for example, prostaglandins, thromboxanes and prostacyclins are synthesized via the cyclooxygenase pathway. The cyclooxygenase enzyme exists in two isoforms. One is COX-1, that is cyclooxygenase 1, and the second one is COX-2 or cyclooxygenase 2. Then regarding this COX-1 is responsible for the physiologic production of prostanoids. Okay, it is a predominantly constitutive enzyme that regulates normal cellular processes such as the gastric cytoprotection, vascular homeostasis, platelet aggregation, and reproductive and kidney functions. Okay, and this is mainly present in the gastrointestinal mucosal cells, renal tubule cells, and platelets. And this COX-1 is responsible for the formation of prostaglandins involved in regulating the homeostatic functions in the body. And next is the COX-2 or the cyclooxygenase 2. It is an enzyme that speeds up the production of certain chemical messengers called prostaglandins that play a key role in promoting inflammation. Okay, this causes the elevated production of prostanoids that occurs in sites of chronic disease and inflammation. It is constitutively expressed in tissues such as the brain, kidney and bone. Its expression at other sites is increased during states of chronic inflammation, and the cyclooxygenase 2 is an inducible form. Differences in the binding site shape have permitted the development of selective COX-2 inhibitors, and this COX-2 occurs in the fibroblast, chondrocytes, endothelial cells, macrophages and the mesangial cells. It forms the prostaglandins that mediate the pain and inflammation. Additionally, expression of COX-2 is induced by inflammatory mediators such as TNF-alpha and interleukin-1, but can also be pharmacologically inhibited by glucocorticoids, which may contribute to the significant anti-inflammatory effects of these drugs. Here you can see the image for the cyclooxygenase pathway. Here you can see COX-1 and this is COX-2, and the COX-2 is induced by oxidative stress, injury, ischemia, seizures, neurodegenerative diseases, etc. As a result of this, from the membrane phospholipids, arachidonic acid is generated, which is the precursor, and from the arachidonic acid, by the action of COX-1 as well as COX-2, the prostaglandins are released. By the action of this COX-1, the prostaglandins released involved in regulating the homeostatic functions in the body, whereas this prostaglandins released or formed as a result of by the action of COX-2, it mediates the pain and inflammation. Okay, and here you can see the non-steroidal anti-inflammatory drugs, whereas the NSAIDs, it blocks the COX-1 as well as COX-2, and thereby it is classified as there is non-selective COX inhibitors as well as selective COX-2 inhibitors. And the next one is a lipooxygenase pathway. Alternatively, several lipooxygenases can act on arachidonic acid to form the leukotrienes. So anti-leukotriene drugs such as Silutan, Cefilucast and Montelukast are the treatment options for asthma. This is a lipooxygenase pathway. From the membrane phospholipids, arachidonic acid is generated, and from the arachidonic acid, by the action of 5 lipooxygenase enzyme, leukotrienes are formed. Now let's see about the actions of prostaglandins. These actions of prostaglandins are mediated by their binding to a variety of distinct G-protein coupled receptors in the cell membranes. Prostaglandins and their metabolites act as local signals that fine-tune the response of a specific cell type. Their functions vary depending upon the tissue and the specific enzymes within the pathway that are available for that particular site. For example, the release of thromboxane A2 from platelets during tissue injury triggers the recruitment of new platelets for aggregation and local vasoconstriction. However, prostacyclin, it is denoted as PGI2, it is produced by the endothelial cells, has opposite effects. Okay, so this prostacyclin has opposite effects as that of thromboxane A2. That is, the effect of or the function of this prostacyclin is to inhibit platelet aggregation and produce vasodilatation. The net effect on platelets and blood vessels depends on the balance of these two prostanoids. So more about this thromboxane A2 and prostacyclin I have clearly mentioned in the antiplatelets chapter. Now we will learn about the therapeutic uses of prostaglandins. These prostaglandins play a major role in modulating pain, inflammation and fever, and they control many physiological functions such as acid secretion and mucus production in the gastrointestinal tract, uterine contractions and renal blood flow. And these are the chemical mediators released in allergic and inflammatory processes. So in a summary, we can say that these prostaglandins are lipid autocoils derived from arachidonic acid. They both sustain homeostatic functions and mediate pathogenic mechanisms including the inflammatory response. And they are generated from arachidonate by the action of cyclooxygenase isoenzyme, that is COX-1 and COX-2, and their biosynthesis is blocked by non-steroidal anti-inflammatory drugs. Now we will learn about the prostaglandin analogs. This is very important in case of exams. So prostaglandin E1 analogs. Examples include alprostadil, lubiprostone and misoprostol. Then prostaglandin F2 alpha analogs. Examples include bimatoprost, latanoprost, tavoloprost and travoprost. Then prostacyclin analogs. Examples include epoprostinol, iloprost and treprostinil. So the first one is prostaglandin I2 or prostacyclin. Examples include epoprostinol, treprostinil and iloprost. These drugs are potent pulmonary vasodilators, so that these drugs are used for the treatment of pulmonary arterial hypertension. These drugs mimic the effects of prostacyclin in the endothelial cells. The function of prostacyclin is to inhibit platelet aggregation. These agents have short half-lives. These drugs causes inhibition of platelet aggregation, relaxation of smooth muscle and vasodilatation of the pulmonary arteries. Epoprostinol and treprostinil are administered as a continuous intravenous infusion, and treprostinil is administered orally or via inhalation or subcutaneous infusion. Inhaled iloprost requires frequent dosing due to the short half-life. Bronchospasm and cough can also occur after inhalation of iloprost. And the next prostaglandin analog is PGF2 alpha analogs. Examples include bimatoprost, latanoprost, tavoloprost and travoprost. These drugs are mainly indicated for the treatment of open-angle glaucoma. They increase the uveoscleral outflow and thereby reducing the intraocular pressure. These drugs are administered as ophthalmic solutions once a day and are as effective as timolol or better in reducing the intraocular pressure. Timolol is a beta blocker. Then one more important point is that the bimatoprost, it increases the eyelash prominence, length and darkness, and it is approved for the treatment of eyelash hypotrichosis. So the drug that can be used for the treatment of eyelash hypotrichosis is bimatoprost, which is a prostaglandin F2 alpha analog. Then ocular reactions include blurred vision, iris color change, that is increased brown pigmentation, increased number and pigment of eyelashes, ocular irritation, and foreign body sensation can occur. And next we will see about prostaglandin E1 analogs. Examples include alprostadil, lubiprostone and misoprostol. So first one is this alprostadil. It is naturally produced in tissues such as seminal vesicles and cavernous tissues in the placenta and in the ductus arteriosus of the fetus. So what do you mean by this ductus arteriosus? This is a normal fetal artery connecting the aorta and the main lung artery, which is the pulmonary artery. This ductus allows blood to detour away from the lungs before birth. Every baby is born with a ductus arteriosus. After birth, this opening is no longer needed and it usually narrows and closes within the first few days. Sometimes the ductus doesn't close after birth. Failure of the ductus to close is common in premature infants but rare in full-term babies. Okay, so the ductus closes soon after the delivery to allow normal blood circulation between the lungs and the heart. In case of neonates with congenital heart conditions, infusion of alprostadil keeps the ductus open, allowing the time until surgical correction is possible. Okay, so one of the main use of this alprostadil is to maintain the patency of the ductus arteriosus during pregnancy. This alprostadil is also used for erectile dysfunction. So the two important uses of alprostadil is that first one to maintain the patency of ductus arteriosus during the pregnancy, and also it is used for erectile dysfunction. Next drug is lubiprostone. It is indicated for the treatment of chronic idiopathic constipation, opioid-induced constipation and irritable bowel syndrome with constipation. Okay, so one of the most important use of lubiprostone is to treat constipation. Then its mechanism of action is by stimulating chloride channels in the luminal cells of the intestinal epithelium, thereby increasing the intestinal fluid secretion. Nausea and diarrhea are the most common adverse effects of lubiprostone. And the next drug is misoprostol. This drug is used to protect the mucosal lining of the stomach during the chronic NSAID treatment. This misoprostol interacts with prostaglandin receptors on the parietal cells within the stomach, thereby reducing the gastric acid secretion. And furthermore, this misoprostol has a gastrointestinal cytoprotective effect by stimulating the mucus and bicarbonate production. This combination of effects decreases the incidence of NSAID-induced gastric ulcers. Okay, there is a combination product containing the NSAID diclofenac and misoprostol available. And off-labelly, this misoprostol is used in obstetric settings for labor induction, since it increases the uterine contractions by interacting with the prostaglandin receptors in the uterus. This misoprostol has the potential to induce abortion. Therefore, this drug is contraindicated during pregnancy. Its use is limited by common adverse effects including diarrhea and abdominal pain. So we have completed the prostaglandin portion. If you have any doubts, or you can share your valuable comments in the comment section. Thank you everyone for watching this video. Have a nice day.